All right. And this recording will be made available next week along with this presentation and any shared notes. I'm going to kick it off with a quick introduction and grounding, since I saw a lot of new names and organizations in the registrations. So my name is Shin Lee. I use she, her pronouns, and I am the network coordinator with the Oregon Community Food Systems Network. We're a staff of 2 right now with a lot of support from our backbone organizations, the OSU Center for Small Farms and Community Food Systems, as well as Oregon Food Bank. We are made up of about 60 plus organizations from across the state who are all working on supporting and reimagining local and, sorry, Kaylee, do you mind turning off the rooms for me? Thank you. Where was I? We're made up of about 60 organizations from across the state who are all working on supporting and reimagining regional and local resiliency in the food system across Oregon. And we're going to do our best today to stay true to the schedule in respect of everyone's time. And obviously this means we're not going to get to talk about everything that we need to. But I think through this mini convening, it's just the start of a conversation, and it'll help us figure out what additional spaces we need to hold in the next few months. And so we can move on to the next slide. I think as folks are arriving in the space today, just if you can put your name, your pronouns, your organization, and what's your favorite snow day activity, and we can just get to know each other a little bit. And then Emily is going, and then today we will, oh, there we go, thank you. And today, this mini convening is also co-hosted by the 2 working group coordinators for the Veggie Rx group, Kaylee Summers, as well as Michelle Rose. And then we're also going to launch a quick poll right now just to take the temperature of where everyone's based out of. And on the next slide, you can see just a quick list of the registrations we received, some of the different organizations that are here with us today. And I saw some last minute registrations come through as well, so I'm sure we don't have everyone. And then the next slide also shows how folks responded in terms of what we're hoping to get out of the mini convening. And so a lot of folks said support and help in operating a Veggie Rx program, interest in launching a program, as well as interest in supporting existing programs. Those were kind of the top 3 that came across the board. And then finally, we'll take a quick look again at the agenda. And then I will pass it over to Michelle. I know we have about 10 minutes slotted for just some celebrations.
Yes, thank you, Shin. Good morning, everyone. Thank you guys for being here today and joining us here for this mini convene. This is a time that we would like to take to kind of honor the work that you're doing in community and say this is a moment where you could get your shine on by sharing what it is that you have accomplished, things that you're so proud of that you've accomplished. And I want to say that, you know, we appreciate each and everyone that's here. And so sometimes we forget to kind of like sit in a space of gratitude and to say, you know, this was difficult, but I achieve it, and pat ourselves on our backs because we're so busy doing the good work in community. And so let's get your shine on. And so I'm going to start this off by saying about me, to say that in 2022, it was a great year for me. It was also a difficult time for me, my work, and for my family. And this year start off with a slow start and with some really good victories that we've accomplished with my work that we're doing in community. And one of which is recently I was invited to participate on a leadership forum with the city commissioner, and they selected a small group of CCOs and CBOs, and we are piloting a program, and one of which that's going to be launched statewide. And so I think it was a difficult thing, but I feel like we're in a good place with this program. And so I feel very proud for what we have achieved thus far and will continue to do as the program move forward. And so I would like to now open the floor to everyone else. So if anyone would like to talk about their personal victory, if you can unmute and speak. And for anyone who is not able to do so in the time that we have allotted, if you could just put it in the chat box, and perhaps we could put it in our newsletter that goes out, the next one that goes out. Thank you so much. And please unmute and share with us.
This is Marcy McMurphy, and I work for the Gobi arm of the Eastern Oregon Coordinated Care Organization. And a big celebration and accomplishment that I had that's taken like 2 years to achieve is creating a relationship with Albertsons and Safeway Corporation, and specifically working with Faith Bontrager and creating a workaround for our Frontier Veggie Rx program in Lakeview, Oregon, which Safeway is the only grocery store there. And we were trying to figure out a workaround because they can't do paper vouchers. So we were able to create a pilot project that potentially could go to other areas. And I just found out that this is the only Safeway rural program that they have. So it's super exciting to be a part of this and to have stuck to it and not given up in these 2 years that it has taken to create these relationships and to move forward with it. So we've had an active program now in Lake County since December 1st of 2022. So we're just a baby program, but super excited.
Very excited, Marcy. Thank you. Congratulations. Anybody else have any to share? Please unmute, or perhaps you could share it in the chat box.
I joined late. Was this specifically relating to Veggie Rx?
No, it's not. You could share whatever your organization, Victory. Certainly, Veggie Rx is wonderful news to hear, but yeah, it's open for all.
Great. Well, this is Debbie Farr. I'm the Community Relations Manager for Trillium Community Health Plan, CCO. And Trillium partners with Rockwood Community Development Corporation on a food program through their food hub. And it's dedicated to culturally specific produce. Not just culturally specific produce, it includes other produce as well, because there's a lot of produce that cultures use that all of us use. Rockwood is a very diverse community. There's about 88 different languages spoken there. And so what they do is they work with local farmers who grow the produce and then sell it at their people's market. They buy additional produce from the farmers, and then they include that for free in their food hub. So anyone can come that lives in the Rockwood community and participate in getting food there. And so there are specifically vegetables that they consider culturally specific, but then there's lots of others like onions and peppers and lettuces, tomatoes, things like that, that mini cultures use. And this is our third year. We're entering our third year of supporting Rockwood with this program. So exciting stuff.
Excited indeed. Thank you so much, Debbie, for your work. Congratulations to year 3. Are there anyone else that would like to share?
I'll share. This is Juliet. Oh, sorry, Shantae, do you want to go ahead?
Oh, no, go ahead. I'll go after you.
Okay. This is Juliet. I use she, her pronouns. I'm the program manager for Veggie Rx Umpqua down here in Roseburg in the Umpqua Valley. And this is a really good exercise for me because there are so many challenges with running the Veggie Rx program that I am pretty consumed with those. So it's just helping me kind of reflect on the good things, which there definitely are good things. I would say the biggest thing is that we're just hanging in there, continuing with our program, going into year 5 now. And we got a good amount of money from our coordinated care organization, Umpqua Health Alliance, this year that's very supportive of the program. So that part is going really well. There's so many other variables that are a challenge, but that stuff is really good. And then one other thing that I just want to share that's unrelated to Veggie Rx that I'm really proud of and excited about in our community is that as the community engagement director with Thrive Umpqua, I helped, along with other community leaders here, start a BIPOC or a Black, Brown, Indigenous people of color only group. That's the first of its kind in our community in March of last year, and it's grown to about 125 members now. And we meet monthly, and we also got funding for the Umpqua Health Alliance for that group. And so we get to do fun things and have food at our meetings and do like excursions and outings and maybe some programs for ourselves and for the community. So that's going really well, and it's capacity building for our BIPOC leaders here as well. So yeah, just wanted to share that. Currently, it's called the Umpqua Valley BIPOC Community, but we're kind of looking at a more permanent name at this point. So yeah, some good news to share with y'all.
That's wonderful, Juliet. Congratulations.
Michelle.
I am especially proud to know that in a year, how that program expands with the Black and Brown folks out in your community. Thank you so much. Shantae, good morning.
Good morning, everybody. Shantae Johnson here. I am representing in 2 roles. One is with Mudbone Grown. We've been farming for about 8 years. Mostly a CSA farm, and I'm excited to share that we secured our own contract with Care Oregon this year, and we'll be serving about 100 families with our collective crops. I'm working with Black and African farmers, and so really excited about that. We are looking to expand into more institutional markets, doing it more as a collective model. CSA is a heavy lift for a lot of single farmers, and so we're going to go at it collectively and looking to expand. The other thing is our nonprofit Feed 'em Freedom Foundation is looking to do more organizing and with Black and African farmers to make a connection into institutional markets. And so I've been working with Healthcare Without Harm and EcoTrust and the Oregon Department of Agriculture on a special project, Oregon Farm to School project, that is going to be making sure that BIPOC producers are making connections to healthcare systems and institutions. And so what we see in the future is that for a lot of small BIPOC producers, the way to go is through collective cooperative models. And so be happy to share some updates, but we do a lot of work out in Rockwood as well. So we have a few different food pantries through Feed 'em Freedom Foundation that we run about 3 days a week, and are just really excited to be able to expand and work with more immigrant and refugee farmers in the future. So just wanted to share that.
Thank you so much, Shantae, and congratulations on your success and continued success for the future in both the projects that you're working on. And now I have to say that it is time. I have to pass it on to our next step, which is we have another poll.
Thanks. Thanks, Michelle. If hopefully y'all can see this poll, but this is what y'all answered this morning. So we just wanted to get an idea of where everyone was geographically based, which is on my end is not showing. I don't know, Shin, if you know how to show that. But looking at the question about does your organization have a Veggie Rx program, it looks like 50% of people who responded said, yes, we've got a Veggie Rx program. There are 7 programs that don't yet have a Veggie Rx program, and some folks that don't know, which I just want to say some people are coming from larger institutions, and there might be smaller programs that they don't yet know about and are interested in learning more. So, and it looks like we got in the chat here, the answers are where everybody are coming from. So North Bend, Southwestern Coast, Coos Bay, Curry County. I've got folks, again, Southern Oregon coast, coastal area, lots of folks from Portland, Tillamook area, Wheeler, Pendleton, but also serving in Baker, Gillum, Grant, Harney, Lake, and Malahir, all the counties out. I'm assuming that might be Marcy, but maybe we have some other representation out that way too. Lane County, Eugene area, Roseburg, Tillamook area. So lots of different places represented. Thanks for jumping on the call today. And I'm actually gonna jump over and pass things over to Emily to share a little bit. We collected some information also before this mini convening about sort of the state of the union of Veggie Rx programs in Oregon. And so wanted to let Emily talk about that for a little bit.
Awesome. Thank you, Kaylee. I'm also going to launch another poll question just to answer whenever is appropriate for you, just addressing some of the question or the challenges you're facing. I'll just keep that open indefinitely, and then we can come back to it later. So this is a little map I made just of the current geographical spread of the different Veggie Rx programs I'm aware of. You all have probably received numerous emails from me. So from that information, I kind of just mapped out where it looks like Veggie Rx programs exist across the state. If you notice, Umatilla is a dotted line around there. That's just because it's not technically a Veggie Rx program because they don't have a provider prescribing the produce box, but functionally they operate just the same. So I figured folks are still being served there. So I thought I'd include it. But as you can tell, there are still lots of gaps in the state. So I'm going to continue reaching out to people and seeing if Veggie Rx programs do exist there and we just aren't aware of them yet. But at the moment, it looks like there are just some gaps across the state. But if you can see, there's different colors here and just corresponding to the different programs on the right-hand side, those are the different names. So quite a few programs at this point. And then in the future, I'm gonna reach out to all of you program operators and try to assess get a better idea of how these different programs are operating, how they're comparing to one another, how they're contrasting to one another, just to get a better sense of a more in-depth idea of what the current programs are, and to be able to better identify some leverage points for future standardization and expansion. There's in a few slides, there's a link to a survey or a list of potential census survey questions that I'll be sending out. So would love your feedback as to what type of data you'd like us to be collecting and what type of information you'd like to know. So I can speak more on that once we get to that slide, but just keep that on your radar.
Thanks, Emily. And if you don't see your program listed there on that beautiful map, please reach out to us. Here you can see Emily's email address here, emily.carlson. Reach out. Those census questions really give us a better idea of the different components of Veggie Rx programs in Oregon. So as Emily was saying, typically we default to this definition that the National Produce Prescription Network is using of some sort of connection to a healthcare provider, a clinic, a health system. But certainly we have the choice in Oregon to define it how we like and how it best functions for our different communities here. So please give us feedback on that as well. We'd love to hear from you. And if we go on to the next slide, we're going to go to the next portion of the agenda and talk from the CCO perspective of things, of how folks are already engaging in produce prescription or Veggie Rx work within their CCO, and also some of the pros and maybe challenges of engaging in this work. What are some of the advantages and challenges that CCOs see in funding these programs through the healthcare system? And we've got a few guest speakers today, and I'm actually going to start, if you're okay, Marcy, with Marcy McMurphy from the Frontier Veggie Rx program, which is associated also with the Eastern Oregon Coordinated Care Organization and GOBI. And Marcy has been doing some very fabulous work in her community, and not only has been engaged from the CCO side of things, but engaging in other community in partnership with other community partners. And as you had mentioned before, you feel like a baby organization or program, but gosh, that baby is growing up so fast. And we'd love to hear more about what you're doing. And also, some of you had seen in the agenda that we wanted to talk about the 1115 waiver, and we'll get into that a little bit. But that, Marcy, what y'all have been thinking in plans for that as well. So yeah, if I can kick it over to you and give us a little bit more insight about and some more details about your program, that would be awesome.
Will do. And I don't know what's going on here, but I have like the screen for the polls, like the ability to like end the poll or share the results. It's like on my screen right now. So I don't know.
It's on all of It's okay. I just gave you co-host ability. That's probably
okay.
why.
Okay. So I don't know how to get rid of it without like sharing the results of what I'm seeing.
You can just exit out on the top left.
Okay, hold on one second. I'm so sorry.
It's all good. If you exit out and it closes the poll, we can always restart it. So don't worry about that.
Very good. Okay.
Marcy, you are on mute, but we can see your screen. We got this.
Okay, so can you hear me now?
Yes, but we can't see your screen now.
Okay, let's. Okay, so it's not allowing me to share at the same time, apparently, as being able to speak. So I'm just gonna talk through it, and maybe you can share the slides out at a later time. So I'm Marcy McMurphy, as they've said, and I am with Greater Oregon Behavioral Health Incorporated. which is, there are two owners, main owners of EOCCO. Gobi's one of them, Moda's the other one. So I'm with the Gobi arm of the Eastern Oregon Coordinated Care Organization. So we serve all of Eastern Oregon from border to border, Baker, Gillum, Grant, Harney, Lake, Malheur, Morrow, Sherman, Umatilla, Union, Wallowa, and Wheeler counties. And the current counties that we have our Frontier Veggie Rx program in is Gillum, Harney, Lake, Malheur, Sherman, and Wheeler. So half of them, which is super cool that we are able to serve such a large area. So we initially started in 2018 in Sherman County, and we actually didn't start it. It was Gorge Grown Food Network that started that program there. And then as funding started coming into the scene, we decided to start using the CBIR funds through EOCCO, through Gobi. And so in 2019, we added Gillum County, Harney County, and Sherman County all in at the, the same time, and wrote a single application. Then in 2020, we added Wheeler County into the mix. And then in 2021, we added Lake County into the mix. And then Malheur County was added in 2022. So we've just been kind of adding these little counties in as we go, and expanding the program and learning from each one. So with this program, we have three main supporters or partners of the program. We have Gobi, who supports with my time, covers all of my travel. We print and we ship the paper vouchers. We reimburse shipping costs, all of those things. And then EOCCO makes the commitment of the annual support with the Community Benefit Initiative Reinvestment Funds, so the CBIR funds. And then they are also helping to lead us in this conversation on how the 1115 waiver is going to affect what we do. And then the final partnership that we have is with our local community health partnerships. We used to have 12 community advisory councils, one from each county. We recently have moved to a single CAC, and now have our 12 local community health partnerships. So they help with getting us started in the community by meeting the vendors, by figuring out who is best to do the prescribing, and having that local support. So some positive impacts that we've had from the Frontier Veggie Rx program is it's increased accessibility to the households, getting the prescriptions and getting the produce fresh and frozen. And it's also increased the availability. So we've had little markets like the Grass Valley Country Market and the Wasco Market. And we're working right now to try to get a little market in Rufus as one of our partners. And it has increased the variety of fruits and vegetables that are available to people. So for instance, the Wasco Market, there are little shining bright penny in the group. They are known for their meat sales. They have a butcher right on hand there in the little town of Wasco. And they used to have produce that would go with meat. So like making a stew. Now, you can go in there and you can find pomegranates and you can find pineapples and just a huge swath now of produce. And their produce now is outselling their meat sales, which to me is just like awesome. And then it's also raised the boats of everybody in the community because it's reduced the cost of produce for the whole community. The vendors are finding that they're having less waste because more is being sold. They're able to purchase in larger quantities. That also helps to drive down the cost. So some of our next steps is we're wanting to move to a card system versus the paper voucher system. And really we are unable to grow at this time because the paper system is so cumbersome. Part of the problem of moving to a card system is it's difficult for our small vendors who may have internet access issues. So like Mitchell does not have like a regular ongoing contact. I think they still might have like dial-up service or something there. I mean, it's pretty remote. And then also just the cost of purchasing new point of sale systems that can maybe handle utilizing a different type of card system. So also finding a permanent funding stream for our projects. That's also something that I know is on all of our minds. We would love to have like hard ongoing funding that we know is going to be there from year to year to year, instead of the soft grant funding that we have to like scramble for and all of that. So then the next thing that we're doing is the conversations around the 1115 waiver. And we're just starting this conversation. We're looking at the nutrition supports, and they state that they include one or more of the following: links to community-based food resources, nutrition and cooking education, medically tailored meal delivery, meals or pantry stocking for children under 21, and then fruit and vegetable prescriptions for up to 6 months. But then it also says it may not supplant any other available funding sources, whether that's local, state, or federal programs. So then what does that mean for us with established programs, with kind of established funds? How do we work around that? So that's something that we're thinking about. And then also, who's then eligible for these health-related social needs services? So we have youth up to age 26, children who are welfare involved, people who are experiencing homelessness or at risk of homelessness, other adults that are dual enrolled with Medicaid and Medicare, people being released from custody, and people at risk of extreme weather events. So how do we as local programs determine who fits into these categories? How are we going to have to like add on all of these questions in our process in order to figure out who gets 1115 waiver programs and who doesn't? So, and that's going to create a burden for a lot of our prescribers who Frontier Veggie Rx is really just another hat that they're putting on, and it's a very small hat compared to the other hats that they wear. And then how also do we determine if they're on the Oregon Health Plan? Our program already does ask that question, but we don't require them to like give us their OHP number. So is that something that's going to have to start, we need to start collecting? And then how does this work in Eastern Oregon and our frontier and rural communities? Is it going to look a lot different? We don't have a lot of soup kitchens or community meal sites in our area. So how does that like factor into all of this? So there's a lot of questions still. So some preemptive actions that we're taking is right now we're in the process of our share funds, our Supporting Health for All through reinvestment. We're asking the applicants to identify if they work with these populations, and we've listed them out. Do they have programs that serve anybody in these programs? We don't know how we're going to handle that yet, but we wanted to have a heads up for the programs that are, so that we can start figuring out how to help them set up their programs, or us to set up our end of things so that we can track that. And we really are working closely between EOCCO, GOBI, MODA, our local community health partnerships, our prescribers, and our vendors. We're all working together to try to figure out how do we make this uncumbersome. I'm not even sure if that's a word, but try to keep it as not cumbersome as possible. So we're anxiously waiting for the Oregon Health Authority's guidance on this, and yet we're still having all of those conversations to try to figure out where we're going and what we're doing and how we're going to handle these 1115 waiver. So I'll put my name and my email address in the chat. And I just want to thank everyone. Thank you, Kaylee, for inviting me to speak today. I always love talking about our Frontier Veggie Rx program. It's one of the shining stars, I think, at Gobi. I might be a little biased, but thanks.
Thank you so much, Marcy. And yes, you are a shining star out in really supporting so many different communities and community members. And I love the story about the local butcher and now being able to provide fresh fruits and veggies to the community, and that perhaps more sales are going to fresh produce than the actual meat. But yes, very, very much appreciated. And I'm gonna step back a little bit because, as Marcy mentioned, and some of you might be very, very familiar with this, and some folks might be, you know, crossing their eyes and looking around thinking, what is the 1115 waiver that we keep mentioning? So I was going to give a little bit of context to that, just so everybody's has a little bit of knowledge on that. And then I think if folks have questions for Marcy, we can also, you can put those in the chat as I'm explaining this. So OHA, the Oregon Health Authority, well, in the state of Oregon, we have expanded Medicaid, which is also Medicaid, OHP or Oregon Health Plan, Obamacare. There's a lot of different names for the same thing. And in Oregon, we have expanded Medicaid, which allows us to cover more than just the very basic Medicaid plan. The 1115 waiver that was just approved through the federal Center for Medicaid Services is going to allow CCOs or coordinated care organizations who manage the care of Medicaid patients or Oregon Health Plan members to pay for things like food supports, what Marcy had mentioned, the medically tailored meals, the Veggie Rx programs, the nutrition support and navigation support for food resources, as well as housing support. And this is just for a subset of folks that have Medicaid. So as Marcy also mentioned, these populations are being named transition populations. So they're folks that are coming out of incarceration, that are exiting the foster care system. There's several different demographics of people that this is targeting specifically for those extra housing and food supports. It's very innovative. We're one of, I think, the first state in the US to have that type of funding specifically for housing and food supports. And as Marcy mentioned, there's a lot of unknowns there of how this will be implemented, how folks will be identified as part of the transition population, because as we know, as food costs rise and inflation continues, folks who are at risk for houselessness, those numbers are rising. And although there is quite a bit of money coming into the state for these, that could disappear quite fast. So over 2023, OHA and the CCOs are going to try and figure out what the policies and guidelines and process for identifying those specific OHP or Oregon Health Plan members is, the screening process for that, what types of food support and housing support will be included in that. And then in 2024 is when they're expecting to actually implement the funding and the process for that. So there's still quite a bit of unknown. OHA just went through a process to convene all of the CCOs in the state to take their feedback and questions and comments around that process. And then they'll also be going through a process to solicit feedback from community-based organizations. It's exciting because there are funding for these resources. There's also, again, a lot of unknowns and questions and how who takes on the burden of all of the process to identify folks and to track these things, and what will be required for tracking and documentation of what the service is that's being provided. On the CCO end too, with needing to connect with these existing programs or create new programs, in that poll that we had asked in the initial registration for this mini convening, a lot of folks said, I'd love more guidance on how to start a program, or support on an existing program, or how do I expand my program? And I'm hearing that from you too, Marcy, of like, we've got a program, it's in its infancy, it's going great. But then if we add in 2024 this extra demand of this is going to be a required service in some ways for a larger population of folks in our community, how do we actually scale that up? And the infrastructure needed, especially in rural areas where there's less food access, or grocery partners and farmers and folks that are able to provide this. So I think there's a lot of excitement and energy around this, and a lot of question marks of how this is actually going to happen. So hopefully that gives everybody a little bit of extra overview of what we're talking about when we're talking about the 1115 waiver. And from a Veggie Rx network side of things, this is also really exciting because we didn't even advocate for the terminology of Veggie Rx programs in this 1115 waiver, but this has been on a lot of folks' minds. And the folks at OHA that wrote that waiver to the federal Center for Medicaid Services to actually include that language in there, which we're hoping that, again, that will leverage more buy-in from CCO partners and healthcare systems to invest in these programs, that we want to be serving more people. We see the impact of these programs, and this might be, again, the kind of impetus and motivation to help invest in these programs on a capacity level, because also, as you mentioned, Marcy, the voucher system works, especially in communities where internet may be an issue. These other technology kind of issues come up, but then also in a more urban area, how do we expand that, again, with staff capacity and kind of administering these programs? So just to give you a little overview of that. Shantae, I see your hand raised. Feel free to unmute yourself, and any comments or questions for Marcy or for the bigger group here.
Yeah, this question is for a bigger group. So we are, fairly new to operating our own CSA with Care Oregon. And so, even though we've been doing it and partnering with Zinger in the past, but my question is, what kind of evaluation are folks doing to help support the work? And, I know that a lot of CCOs like data. And so what kind of surveys and things like that, as far as impact goes, are people, using what evaluation, measurements and things like that? I was just curious about. So, yeah.
That's a great question.
Pre and post surveys, those kind of things. Are there standards that people are using to help support their work?
Great. Thank you for bringing up that question. Marcy, yeah, go ahead.
So we found pre and post surveys to be difficult. So pre-surveys were great. Post surveys were really hard to get and done. So what we've done is we've added pre and post surveys, and I guess you'd also call them post surveys, all in our enrollment form. So households, as they come on and we complete the enrollment form, we ask them questions that have been through our work group of figuring out what are the best questions to ask, so that it's across the state asking the same questions. And then we renew people on an annual basis, so they have to complete that same form the next year. And we have an extra section for returning clients or participants, that they then have to answer those questions as well. So it's giving us that questions, survey questions, the post survey questions. And then I'm not a data person, but I have a data team with EOCCO, and then they look at that and they do all of the figuring on their end. And so far they're very happy with what they're seeing. And then also, I do know our redemption rates of our vouchers is like around 96%. So people, when they get the vouchers, they're using the vouchers like almost immediately. So I just share that little bit.
Thanks, Marcy. And I would also mention that the Veggie Rx working group for the last couple of years has been getting together on an annual basis before the programs open. We just had that meeting last week. What is time? And part of that was also just trying to make sure that when possible, let's all ask the same questions. We can capture similar data. So this way, programs, even if they have different operating models, all that information gets captured in a similar way, so we can make a bigger case as, a larger coalition. And so Shantae will definitely share that out, but we'll also share that out with the rest of the group here. We definitely have a list of resources, because a lot of, whether you're looking to launch a new program or you're looking for what are the pre and post surveys or previous presentations, all of that is public and shared. So let's, I think our goal is always, how do we highlight things that this group has already figured out how to do and not try to reinvent the wheel when we don't need to.
Yeah, I'll just echo what Shin said. If anyone's interested in that, we'll send out more information after this meeting too, with the pre and post surveys, and that we've had some support from med students, actually from OHSU, who have helped us compile, aggregate all of the data from the different programs who have participated in an anonymous way, so that we can figure out that impact across the state. And the more the merrier, because the more data we have, the more that we can see what that impact is. And even though the programs operate slightly differently, those pre and post questions are folks are still using mostly the same questions. Also, programs may add in their own tidbits to get more programmatic feedback from participants to improve their specific program. But yes, happy to share that. Love that, Marcy. Swipe from everywhere, steal with integrity and pride everywhere. I'm happy to share whatever I can. Love that. And Juliet, I don't know if you had anything else to add. Juliet's been really involved in the evaluation group.
No, just that we have a shared survey and encourage folks to use it just because it's already made. And like Gil said, we're contributing to kind of this one solid data source. I will say, getting post surveys is challenging. We have a 6-month program, so it's interesting, Marcy, to hear your approach there. I think that's all.
Thank you. Other questions, either for Marcy or questions about the 1115 waiver, or just things that this prompted you to think about? All right, well, keep those thoughts going. You're welcome to put anything in the chat. And oh, great. Yeah, Ecole sorry, there's so many people on the call. You're welcome to unmute yourself.
Oh, it's fine. I was just giving a shameless plug to participate in the statewide evaluations, because you can add your data to look at the statewide impact, and you don't have to do your own statistical analysis because the med students have been doing it. So that's my plug for participating. And we've been doing, I think, have there been 3 now statewide evaluations? Do we know? I think it's 3.
I believe
official
3
ones.
now.
Yeah, and where about 5 to 6 programs have participated. So that's the history of it.
And there's a great report on the OCFSN website from one of those years that is great to look at and pull from. And there is just statistically significant data in those that you're welcome to use that report when you're talking to partners or folks about building out your program too. Great. I have to apologize unless, let me do a quick shout out because I can't really see all of the names yet, but are Jennifer and David on the call from All Care? I don't see them in the list of participants, just in case you're on another name. Okay. I apologize to everyone. I think maybe something came up with on their end. They were going to come and talk a little bit more about All Care, which is a CCO in Southern Oregon. But maybe we'll catch them on another time and day. So I think we're going to actually transition into breakout rooms now. And what we wanted to do is provide a little bit smaller space to talk. Sometimes talking up in a bigger group is a little intimidating, but to give you all space to kind of digest some of this information and what it might look like for you and your specific program areas. We've got some questions here and we'll stick these in the chat as well. But oh, and there is a shared document link here. So we're hoping that someone in the group will volunteer to take notes in the shared document list. So if you open that up, it'll have the notes for every breakout group. So we have it all in one place, but you can just start a new space in there and say breakout Team Tigers, whatever, if you want to rename your group, or just group 1, group 2, group 3. And these questions are: what stakeholders are needed to expand Veggie Rx into a wider audience? So maybe that if you're thinking about your community, your region, are there folks that you don't know who to reach out to, or stakeholders that you're just like, wow, if we had these folks on board, this might help us either start or launch or expand our programming. Maybe you don't even know who those stakeholders are, but you can name out what they would do to help you expand if they existed. In what ways do you see standardization, expansion benefiting your Veggie Rx program or programs in general, and downsides? And I'll give kind of a little bit more context to this. Standardization sounds like a scary word, I think, sometimes, and I think of it closely related to like sterilization or making things into a pretty box. And I want to say that we really, really value, and I think that there's a lot of strength and value in how the existing Veggie Rx programs have really sprouted up, both to respond to the needs of their community, but also utilize all of the strengths and resources within your local community and region. So just like what Marcy was saying about the local butcher shop, right? And we don't always all have local butcher shops in our areas, but to work with those champions to say, hey, are you open to expanding what you're offering at your shop and store? We really want to support you as a local business. And here are some of these other needs, and figuring out what those community strengths and resources are. We all have them. They might just look a little bit different. So we're not saying standardizing so that everybody has to have a local butcher that they work with in their region. More of, there's a component of this food aspect, right? And there's a component of education, and there's a component of that healthcare partnership. There's a component of working in collaboration with those participants or members or patients of the program, right? There's different components that we may all be able to provide, but they look a little bit different for each community. So I just because I think sometimes there's a reaction there of, oh, I have to completely change my program in order to be a standard model of Veggie Rx within the state. So take that question as you will. And then identify any barriers you're facing within your program. So that poll that we launched earlier, like what's top of mind right now? What are those things that are keeping you up at night that you really would like to prioritize? What are the challenges or barriers or kind of things that are coming up? And what questions do you have for us or for others in this group? What questions do you feel like you just can't find answers to that somebody else might be able to support with? So those are the questions. Again, we'll pop them in the chat. Shin, do you have other directions for us?
Yes, I guess make sure if you haven't looked at the chat yet, just click on that shared document so you have that up and ready. And I'm going to break everyone out into groups of about 5, and we will have, how much time we have in this? I think we have about,
oh, sorry. I think we can actually take about 20 minutes for this.
perfect. So we will give everyone a 5-minute heads up when we're getting close. And then I'm going to open the room. And then I will stay in this main room. So if folks have any questions, you can always leave your room and go back to the main room to ping me. Thanks, everyone. Whoop. And then Shantae, you're stuck in unassigned, so I'm going to wait till everyone else moves and then try to move you. Let's see.
Okay, sounds good.
Shin, I was going to stay back for a second to just chat about, okay.
All right, Shantae, great. Juliet and Kaylin, y'all still there? Hold on, I'm gonna pause the recording. Amazing. We have a few more seconds before all the breakout rooms close, and
Jen, do you feel prepared to maybe mention GusNIP, like just a little something about what we've been thinking?
Yeah, sure. I mean, I still haven't heard anything back, but I know that we're looking for people to kind of join possibly a coalition or like create a working group. So I can touch on that, but I don't have any news to report otherwise.
I think just like a brief overview of what's going on with that. Okay. I'll tell you when. Thanks. Welcome back, everyone. Hopefully those conversations were fruitful and exciting and supportive. And we're so excited to see y'all back. We're going to take some time to actually share back. And I realized that I didn't prepare you all to prepare a speaker for your groups. So I won't go group by group, but maybe if we just are able to, you can unmute yourself, you can type in the chat and give us some reactions and thoughts of what came up here. So the themes that might have showed up in your breakout groups. Let's just start with that one actually, to not get too complicated. And I've got lots of screens going on. Where's my mouse? Okay, here we go. Thanks, Genevieve. Thanks for being part of this. Great. Anyone want to kick us off?
This is Marcy, and I think one of the things that I really appreciated about this great breakout group 4 that I had is we had a really great cross section of people. So like people who are policy people and program providers and all of that. So that was really a wonderful mix, which was really, really appreciated for me. So I think it's very nice to talk to a group of people. So I would say the theme is a group of people who are really concerned and interested in the veggie prescription programs and getting produce into households. I think that was probably the theme that I think would be the best one to bring out, is that it was just great being able to share in that environment with people who all want the same thing.
Thanks, Marcy. Thanks for being brave and going first too, and open up the conversation. And I love that is a very true theme of we're better in community, and coming with different perspectives and different pieces to this. So thank you. Other themes that came up for folks? How about some challenges or barriers that might have been expressed in your group, or maybe weren't expressed but are top of mind to you right now?
So again, I'll jump in, hopefully get the pump primed here for everyone, but permanent funding, of course, would be wonderful, like an ongoing line item in the big corporation's budget so that we're always there. An electronic system would help. And then this one that was shared, I thought was so important, and that's the admin costs, like funding for the admin costs of these programs, especially if we're going to be required to start collecting like organ health plan cards or information there. There's going to be HIPAA training and background check information. I mean, there's going to be so, I foresee it as being, and the people in the group see it as maybe being quite cumbersome. So.
Thanks, Marcy. And when you were talking about electronic systems, can you elaborate a little bit more on that?
So moving from paper vouchers to a debit card system, similar to, you know, the SNAP benefit cards that they have now, which we've been in conversation about. It's just one thing I don't ever want to lose sight of.
Thank you. It also, I'm hearing too on the third point that you had about, oh, wow, somebody just plugged their stuff into the chat. Cool. Oh, that's Shin. Okay, great. Sorry, lost my train of thought. On the recording side and having to potentially in the future document or screen and collect different information. And like you said, the challenges of getting everybody, administrative challenges of getting everybody HIPAA compliant, and potentially like electronic systems for collecting or storing that data in a safe way, so that it's secure and is able to be held but shared with potential funders and systems. Yeah. And in terms of funding, we'll talk about this a little bit after this discussion, but and I'll ask Jen to share more about the GusNIP grant opportunity here coming up too in terms of funding. Does that resonate with other folks? Or do you feel like, gosh, I really need funding, I need some electronic help, worried about some of the tracking systems and administration involved in these programs? How about other celebrations of things that are going super well and you're excited about? I know some folks shared some of the celebrations and things that they were excited about earlier in the meeting, but anything come out of your small breakout group conversations? And I'm sorry if you're like raising your hand, I can only see so many people on the screen too. So feel free to unmute. Y'all are shy today. Really? Did you not get to that question? Come on. Oh, he called. Thank you.
Well, I don't have anything to share about my celebration, but I did have one other thought about stakeholders that we were talking a little bit about. Amber asked me a great question, like who are the stakeholders that haven't been involved? And, I've been involved in these conversations for a few years now, and it dawned on me that the clinicians aren't generally involved very much. There's a lot of we've gotten a lot more CCO and government and participation, which has been awesome. And I think we should celebrate that. Yay. But, and we haven't had, I think it would be really interesting. I actually don't know, because I'm a little bit removed. And I don't know if this can be a poll, but maybe we could talk about this some other time. In your various programs, who are the people on the ground giving out the vouchers? Are they the clinicians at this point, or are they an administrator or a social worker, or what kind of clinician is giving out the vouchers? Because it would be interesting to get those people in the room, and it would also be interesting to have more of a robust conversation about screening, because I feel like screening is coming down the road. If we really want to systematize this stuff, we got to figure out how we're screening for the type of the type of population that we're working with, and food security, in all of our various clinical settings, and really urging our clinical settings to do that kind of work. And what would it take? So I remember Lynn from the food bank, Oregon Food Bank, for years was really pushing the whole, screening being a really important piece of this puzzle. And I think that we haven't quite figured that out yet. I'm not thinking up there.
Thank you,
Thanks,
Nicole. Yeah,
go ahead,
I'm
Nancy.
seeing the same thing. That's awesome. And Jazz from our group, who I believe she said she was from the Oregon Food Bank, she talked about network mapping. So it would be really nice to have a map of what is available in our communities, so that we know who isn't available, and also so that we know who the champions are if we have a project or a program or something that we want to maybe reach out to them and have them help with our program as well. So the network mapping came up with a couple different people in our group. I believe Kathy and Jazz both talked about that.
Thanks. And I think, all these things that folks are bringing up, and any notes that you put into that note document. Emily just commented that she'll be sure to put some questions in there in the census survey. So things like that too, that we can collect across the state to kind of get a sense of what's needed out there. And talking about what's needed and what you need support with, what is something that you're working on currently in your program or with different stakeholders that you feel like, gosh, I need some support or resources around?
Something that came up for us in our group was needing more support around nutrition education. So for instance, sometimes we have families that drop off because of various reasons, maybe they're not cooking the food that they're receiving, things like that. And so I know a lot of folks do food demos. And so something that we talked about was, what would it look like to create food demos, or people doing recipes online that you could feature in newsletters? But if this group could come together around creating some videos that we all could use, for some of our Veggie Rx programs, that would be really helpful. So for instance, I was a part of a project with Black Food Sovereignty Coalition called Grandma's Hands. It was a really amazing program. Black grandmothers would cook food, farmers would bring food, and people would pick up their CSA shares, or sometimes they'd be delivered, and they would have the ingredients, but they would record the grandmothers cooking the food, give the ingredients, right? So families can cook it themselves. And then we would have an online group talking about that while people are eating their food, and it was just a way to really build community And it was really sweet because I love, you know, everybody loves grandma's hands cooking, those kind of things, right? So being able to share that with folks was really nice. So we're, you know, resources like that. Also, we talked a little bit about like how are clients identifying what is in their CSA share. And that's something that's come up for us. Like people are like, well, I don't know what a kohlrabi or a shallot looks like or something like that. So having pictures of the vegetable along with like, this is the shallot, this is what you have in your box. Because a lot of us are doing newsletters and things like that. So those are just some of the things we talked about, but how can we, you know, centralize or, you know, use some of the same resources because chefs are really expensive. Paying for video editing is also expensive. So what does that look like? Those are kind of the supports because it does cost a lot as far as administrative needs. And I know that a lot of our partners at CCOs are wanting more add-ons, right? Around nutrition education. So
that's such a brilliant idea. And it makes me think of like, actually, was it Frontier Veggie Rx that you could like kind of choose between an individual consultation with a nutritionist, or there's like a peer cooking group. But what you're saying, Shantae, too, about yes, and great, thank you, Eric, for bringing up CSA Partnerships for Health, some different YouTube videos that are available. And I love the Grandma's Hands videos and group that you were talking about, Shantae. And I think like, wouldn't it be cool if people had an option of if they have, you know, reliable internet connection or like throughout the season, could somebody, even if they're in Malheur County, sign up for the Grandma's Cooking group and listen in and cook those things, but they could also, if they wanted to sign into Adelante Mujeres, like group cooking classes and kind of explore different cuisines. I know when I was running a program with Adelante, one of the first years, we're using some of the food hero recipes and someone from Extension Service, but it almost felt like the recipes, they weren't very culturally specific, and we felt like we ended up taking that on ourselves. But wouldn't it be cool if there's like some way that no matter where you are in the state, you have an option to kind of sign in or watch videos from different programs across the state that might resonate more with the type of cooking or exploring different types of cuisine and different communities that you might want to connect with instead of just within your region too. So that would be so awesome. Love it. Nicole.
I love that too, Shantae. I love this idea. And I'm like, oh, as a network, we could make it a priority for the next year that everybody makes one video of like either nutrition education or a cooking class or whatever. And then we just post it on the OCF, on the Oregon Community Food Systems Network website. And we build a repository of videos for people to watch so that when and if like people do want to include a nutrition education or a cooking class or whatever, maybe we have it sectioned, they can just refer people to the website, you know, so we have this automatic place for people to go. We could build that resource. Or we can write a grant for capacity to build it.
I love both those ideas.
Eric, did you, not to put you on the spot, but I know you stuck the link in there for the CSA Partnerships for Health. Did you want to give a little explanation of what the videos that you all have?
Sure. It's only a few videos, but it was a pandemic response to be able to have an educational and supportive aspect to the program when we couldn't distribute in person and with delivering shares at that point to households. So it is, Zenger Farm has a community chef program, and these are community chefs who are highlighting some of their favorite recipes, because we had also identified the cultural relevance and specificity, and this was our pivot to be able to do that. So we do have some videographers and people we've worked with in the past, and I'm very happy to share that with anyone who may be interested in working in that.
Shin, OCSFN has a YouTube channel. That's so cool.
And let me be clear, there's not a ton on there right now. All that's on there is, again, like trying to just have more transparency and like accessibility of previous working group calls and presentations. And so that exists. And the website itself too is, you know, especially on each of the working group pages, it's a repository of a lot of the really great work that has already been created. Like even just for the Veggie Rx group in general, there's a couple toolkits on how to start a program, some best practices, and yeah, and also just looking at the chat, I absolutely agree with, we don't need to reinvent the wheel, and it's always fun to learn new skills. I mean, I'm learning how to do punch needling right now, which is fun, and like using a sewing machine, but you know, if we were going to create something that is really accessible and beautiful, there are plenty of other organizations that already have those competencies. So how do we pull them in, and how do we reach out and and do collaborations? I think that's where my head always goes of, you know, the more brains sometimes the better. And also like these things are all so iterative as well, you know, like the first, like V1 of it is not going to look like, you know, V10.
This is so great. I'm just like reading through the chat too, and so many resources out there. Thanks, Sarah, for talking about the collaboration with other existing programs and capabilities. And it looks like folks have, you know, may have a few videos here and there, but if we're able to compile those all into one place or a list of video resources, and and Juliet, this comment too about a video of volunteers buying produce at a farmer's market. Farmer's markets aren't necessarily a place where everybody has, not everybody has gone to a farmer's market. So even giving kind of an intro of like what to expect, and different tips and tricks, and the like added benefits of some more physical activity, and the seasonality of vegetables, and just some of those other things that we might take for granted if farmers markets are on our weekly circuit, but we have participants that are new to these food outlets. So making those kinds of things, and not all just around cooking, but storing and preserving food, and how to make it last longer, and all of that. And Jesse too, about the playlist, like there are a lot of YouTube videos out there. Like if somebody doesn't know what kohlrabi and shallots are, like maybe just making that playlist of useful videos, because it can be intimidating to get online by yourself and be like, I need to find a recipe, but which one is actually going to be easy and you know, only require the ingredients that I currently have in my basket or my pantry. So this is great. The Providence Community Teaching Kitchen, again, like all of these things that there's a few recipes in here and there, but compiling that into one place. Great. Yes, senior projects. Like there's students out there that want to do these kind of things. I talked to a med resident this week who really wants to bring in a culinary aspect to medical residents training, and so that doctors can be more informed and excited about talking to their patients about food, not just saying you need to eat better, but like here are tips and tricks and ways to do that. So great. Cool. Any other things that like you feel like, gosh, I really need some support on? or need from this group, or other things that you really feel like, oh, Emily, go ahead.
Hi. Something that stuck out to me from my group, and I'm coming from kind of the farming world, but Juliet was mentioning that, you know, before they had been using a small farm stand with limited hours, and now they're planning to expand to Walmart and Fred Meyer, and that they had wanted to use a smaller local grocer, but that there was like a technical issue with, and Juliet, I'm sorry if I'm getting any of these details wrong, but that really struck me, that it would be like a technical limitation that is then going to limit, you know, their opportunity to support local farmers. So I was just curious if other people have support on like how, you know, you can make sure to direct resources towards keeping the funding with local farmers and not having to resort to the bigger stores.
I think in just adding on to Emily's question, I also kind of want to ask the group in terms of like the technology side of things, is there state level funding specifically that anyone has currently been accessing for their programs around the technology side of this? Or even with SNAP?
I mean, there's the state level funding for the SNAP match, right? Like the Double Up Food Box program. But I don't know about other funding.
I think this question, Emily, that you have is a really great one, and it's really big. And I think oftentimes we run into this where like customer convenience versus also investing in the local economy and food system, so that we have a more robust and sustainable food system, so that it grows, so that it's more convenient, so that, you know, and so I know when I was operating a program, it was always like this really tough line to walk, and really wanting to emphasize that. So let's keep that question in our minds and keep coming back to it to really figure out, you know, it might not be one solution, but it might be an evolution of those things. Yeah. Ecole, let's take Ecole as the last comment or question, and then we're gonna jump on to kind of wrapping things up too.
It's about Emily's question, and I guess I just want to put a plug in. Emily, there are a number of us that really feel strongly about this, and in my opinion, if we ever did a statewide grant, when Kaylee was talking about those components of standardized programs, I feel like that would be an important component that it doesn't necessarily have to be the only source, but I do think that some of the funds need to go to local farmers. So I'm just going to put that out there. Like, it feels really important. I want the local farmers to feel supported. I can't guarantee that that's what's going to happen, but if I have any say, that I will put that plug in there.
And that's a really great segue, Ecole. Thank you. I'm going to pass it over to Jen because we have been looking into GusNIP funding, and I will let you explain a little bit more here.
Yeah, thanks. That is the perfect thing. Ecole, we are hopefully going to do that. I just submitted a proposal for a grant, and we've been waiting. I've been checking my email because we should be hearing back literally any day about a capacity building and technology grant that the NIH has had for creating like a grant for GusNIP. I know that that's kind of a weird thing, but we need funds to even get through the proposal of a state and federal grant proposal. So we did that, and more information should come hopefully today. So we went for the coalition building and seeking funds for a strategic plan, and that would include everything that we want to have in that proposal. Our last strategic plan was drafted in 2020. The goals set for 2020 and 2025. And obviously we had to pivot, everybody did, because of COVID. So that was like a large part of it. And there is obviously a technology side of it. And, but we're getting all the information together, and we are asking for a group of people to kind of help with that grant for the GusNIP grant for the nutrition incentive and the standard projects. So hopefully we'll get that pass-through grant and allow funds for all of our amazing organizations that are within the network so that we can all get funds and build this all together.
And then I think for additional context, do we have an understanding of timing of when the actual GusNIP grant is due? Or what has it been in the past?
Yes, so we were kind of going between there are a few different ones that we could, there are 3 different types of grants. And so we were going to go for the produce prescription grant, but that one's a little bit small. So now I think we're going to go for the nutrition incentive grant under the standard projects. And that one is, I feel like, is due, I should know this off the top of my head, but it is at the end of April or May 2nd this year. So it's a quick turnaround. We still haven't received the funds from the capacity building grant, but it would be a fast turnaround of trying to kind of get this going. Does that answer your question?
Yeah, I think so. I think part of the challenge is sometimes with these large grants is it's not always on schedule when all the information gets released. So then it ends up being kind of a massive sprint essentially to get a proposal in. And we want to make sure that we're able to get feedback from the folks that are running programs right now, because this is for all of you and all of our work needs to be informed by y'all. And so I think realistically, based off that timeline, probably in the next month and a half, so for folks who don't know Jen did her practical experience with OCFSN and this particular group last year. And now we've contracted some of Jen's time to help us essentially project manage, pulling all of us together to apply for a collaborative grant. So if folks are interested, Jen will drop her email in and she can help coordinate getting a meeting set up, and we can have a much more pointed and focused conversation around that.
And I think we're hoping to use all of the feedback and comments and notes that you all shared today with us to get a better sense of like those themes that are coming up, including this stable funding and electronic solutions, and how do we share resources, whether it's cooking or nutrition education aspects of this, and more of that capacity for administration of programs, especially with some of these new like policies and programs coming through. Yes, thank you, Emily. We skipped over a few like slides. When you get those in, when we send those out to folks, you may see some things in there. So more information about the 1115 waiver process. We have like a few other recorded sessions too about the evaluation report and health related service funds too. So it will maybe take a little bit or maybe a week to like get all of those links out to you. They won't come to you today, but look out for those. Just another thing, we have been talking with OHA about that need for greater capacity, because if CCOs are reaching out to these community-based programs, or even like in Marcy's case, right, trying to figure out how to expand this programming to meet the demand of the services for transition populations through the 1115 waiver. We've been trying to really emphasize that an investment in these programs need to be made for that stable funding and in order to expand those. So that's also there. I just opened my email this morning and I hadn't even shared this with the planning committee, but when we're talking about electronic solutions, someone reached out to me who's been working with WIC to implement eWIC. So those EWIC cards, the Women, Infants, and Children benefit, and they're interested in having a conversation with us about electronic needs for this type of work within the Veggie Rx field. And so potentially aligning that with other state food benefits could be really exciting. So there we go. Or Shin, do you want to wrap us up here, or any last comments, questions from folks in the audience?
I think even just from this conversation, what you just shared, Kaylee, so much of this work is still emergent, and we're not always going to be on top of every single thing, which is what's so cool about being in coalition and in community with each other. So if we ever are missing something, please let us know. And I just dropped in the meeting, in the chat, the shared public folder that has all of today's mini convening resources. And we'll also share out additional content in this recording next week. And if you aren't already connected to the Veggie Rx working group, that particular email list is the fastest way to kind of connect to folks probably on this call, as well as folks who can attend today. And you can self-subscribe now by emailing veggie-rx plus subscribe at ocfsn.org. And once again, thank you so much for showing up and your time and your energy. And we look forward to continuing to be in community with you. We'll follow up next week with a survey, because I know sometimes it's, wow, that was a lot of information in the last 2 hours. Some questions might not really come up until, next week or 3 months from now. We want to hear from you regardless. So yeah, thank you so much, everyone. Have a great weekend.
Thank you.